In this episode, I'll be talking about trauma, medical gaslighting, and chronic illness. Living with trauma in your life causes havoc on your body, mentally, emotionally, and physically. But it doesn't matter if you have a chronic illness or not. The reason I'm talking about it in this episode is because it affects ones with chronic illness differently. Here's my story and how I'm still dealing with the trauma I continue to go through. From an early childhood, parents always want the best for their children. Younger siblings want to be like their older siblings because, come on, who else do they have to look up to? In no way am I putting blame on anyone. Let's just get this out there. We're all learning and growing as each day passes. But right now, I'm letting out all of my truth and trauma so that hopefully I can continue to heal and that this will help someone who is going through something similar. Parents, I plead with you. Please, please do not compare your children with each other or with anyone else's children. When you do that, you're putting competition in the dynamics unknowingly. You're putting low self-worth in your own children's head and heart, making them believe that they are not enough just as they are. Yes, you still need to groom them to be successful adults, but to do that, help them focus on their own strengths and what they as an individual can do and what they are excellent in. When they are constantly belittled and they are told that they should be like their friends and strive for more, you're basically telling them that their best isn't good enough. So when they fail, they want to give up because they aren't rising to your standards. Older siblings. Yes, you may be older and you have more experience, but that doesn't mean that you should ignore your younger siblings. When you do that, all that amounts to is showing your sibling that you don't care about them. Oh, but I'm there for them. I make sure they have what they need. I take them with me when our parents tell me to. They hear the meaning behind all of those words. Yes, you're there for us because our parents told you to do so. You don't do it out of the kindness of your heart. You do it for show. The trauma I have experienced involves both of those examples. Yes, it's true, we were all young and learning back then. But there comes a time when we all have to grow up and learn that it is not okay anymore. There's a time where we all have to grow up and realize where we each went wrong and admit to our mistakes and make those changes. Otherwise, it will continue to eat us up, and in the end, it could be our demise. One of the biggest things ones with chronic illnesses want is understanding. Another is love. If we can't get that in the medical field, our family, our community, where else are we going to get it from? No wonder the rates of suicide are almost 50% because of chronic pain. No wonder the doctors are trying very hard to knock down the opioid crisis, so ones who really need the pain medication can't get it so we can get back to functioning pain. Trauma has its hand on us so strong that we can't even function on a daily basis because of the pain that we are in and the stops that the physicians and the government have put in place to keep us in pain and not functional. We see no way out at times. We need understanding. We need love. We need the caring attention that we have been yearning for, but no one takes the time to even ask or care to want to know what it's like to be in our shoes. Trauma can take a long time, even when we get help for it. Trauma can last even longer and will be much stronger when we don't get help for it. Now, in regards to medical gaslighting, this hits home for a lot of us. We are all too familiar with it. We are all sick of it. And we all know that this must change. Gaslighting in the medical field has got to end. Now, again, in no way am I an expert in the medical field. I'm only speaking from experience. There have been many instances where I have made mention that I have experienced being talked down to and treated, oh, I don't know what's wrong with me, and that I'm only a drug seeker when it comes to my pain. And I'm assuring you, just as I have assured the doctors and nurses, that is not the case. I'm sure many of you have experienced this as well. I would like to know, what have you done when this happens to you? Do you request to be treated by another doctor or nurse? Have you reported the doctor or nurse to the medical board at the hospital? I've done so on multiple occasions. And in one particular instance, I was called back from the office of the hospital director, apologizing for how I was treated, and reassured me that the ones who treated me in such a way would undergo training and that they do not tolerate this treatment at all. I have had to write a few others letting them know how I was treated. It does take time, but as long as we get the word out to them that we're not tolerating the disrespect and prejudice, that is a step in the right direction. Now, this last time that I was in the emergency room and a nurse actually treated me in a very disrespectful way, stating that, well, usually once with your illness is diagnosed at a very young age as a baby. I don't understand. How can you have it now? Why were you just diagnosed? I was having a very hard time breathing because of the pain. And I was being told constantly, you need to slow down your breathing. You need to breathe. You need to calm down. How can I calm down when I am in pain and when I am being disrespected? That is very hard to do. And usually when ones are in pain, we are trying to slow down our breathing. We are trying to take a deep breath. But when the pain is in our chest or in our back, where we have to take a deep breath, that's very, very hard to do. So I implore all of you listening to this episode, instead of allowing these invisible illnesses to continue to be the storm, why don't we take the reins? Why don't we become the storm? Every single time that we are dealing with the gaslighting, not only take note of who it is, the doctor, the nurse, take note of their name. Take note of the hospital that you went to. Take note of the time. If you can't do it, make sure you have someone that is there with you. Make sure you have everything in writing. And then when you are able to, write to the medical director. Write to the board. I will have a list if you are interested in knowing who exactly you should write to. I'll have a list so that you can write to every single person so that you can make a complaint. Because this has got to stop. Don't take your voice and your health rights for granted. I'm going to say that again. Don't take your voice or your health rights for granted. Because a lot of times, ones that are in the health field, especially emergency rooms and urgent cares, yes, sometimes they may be overworked, but they're the ones who signed up for that job. So they should not take out their anger and their frustration on the ones that are coming there to get help. So it starts with us. In order for it to get better, we have to do better. We have to be better. Let's take control of the storm. Let's be the storm. I will see you on the next episode. You all, please continue to be strong, continue to be warriors.